the junior doctors' strike, which is due to start tomorrow, bringing massive disruption once again to our NHS as they fight for a fairer pay deal, as they would put it. You can still call me on 0344 499 1000 because we want to hear from you on another NHS-related story about whether you have simply given up trying to find an NHS dentist. But joining me now is co-chair of Keep Our NHS Public, Dr. John Puntis. Thank you so much for joining us here on the show. Doctors are going on strike tomorrow, called junior doctors, causing more disruption to the NHS. What are they striking about? What are their current demands that they are making of the NHS in terms of a fairer pay deal?
Well, good morning, Jake. Their demands really remain unchanged. That they want to have a significant pay rise. They talk about a 35% erosion of their pay since 2008 in real terms. They want some kind of agreement that their pay won't be eroded to anything like that extent in the future. And they want the pay review body to be independent of government when it makes recommendations over pay. And it's very sad, I think, for all of us that after 5 weeks of negotiations with the Department of Health, no agreement was reached over a pay offer. In fact, they were offered about 3% on top of the 6%.
John, just to bring our viewers up to date, I think the initial request was a 19% pay rise. I think initially doctors are looking for. Part of that was the cost of living crisis. Part of it was a catch-up premiums. I think they branded it in relation to their inflationary erosion of pay. You say the government have come up after these negotiations with 3% offer. Whereabouts are junior doctors at the moment?
Well, I don't think they have discussed a figure. I mean, I'm not party to the negotiations, obviously, but the junior doctors in Scotland settled for a 12% figure, and the junior doctors negotiating committee talks about a credible offer. So I think they're looking for something at least of 12%, possibly more than that.
Do you think it's a bit irresponsible at the worst time of year with increased admissions to hospitals because of the winter flu and all of the challenges we have in the winter for doctors to strike now?
No, there's no good time in the NHS to strike.
There's clearly a bad time, though, isn't there? But there is clear. I accept there's no good time with record waiting lists and all the challenges of the NHS recovering from the COVID pandemic. Even if there's no good time, there's clearly really bad times, and that's during the winter when hospitals are already dealing with the winter crisis or the winter increased admissions, and also over Christmas, where services are reduced often in any event or the build-up to Christmas. Do you think it's irresponsible, or do you think they're doing the right thing?
I don't think it's irresponsible. I think it's part of their bargaining position. They have a mandate for strike action. The Department of Health knows that. They were in talks for 5 weeks and then these broke down. So the membership wanted to take more industrial action in order to increase the pressure on the Department of Health. So I don't think that's irresponsible. I think it's highly regrettable. You know, I agree with Julian Hartley, who is actually the very good chief executive of the trust that I worked in for many years, but he's now chief executive of NHS providers. And he says this just has to be sorted out. It's already cost the NHS 1.3 billion, and it needs sorting. There needs to be an agreement.
Well, of course, I mean, every dispute ends with a negotiated settlement. Can I ask you a separate question? We heard from the Labour Party, Wes Streeting, and the Labour Party yesterday that in order to try and clear some of this backlog, they wanted doctors and other health professionals to be funded, apparently, by the abolition of the non-dom tax status to work at the weekends to deliver a true 7-day-a-week NHS. Do you think junior doctors would be prepared to work all weekend as if it was a normal weekday?
Well, many of them do already, of course, but the idea that you could get the NHS to work on a 7-day-a-week basis without massive investment is a complete nonsense. You'd need all the other departments running as well through the hospital, not just doctors. So yes, you could have 7-day working. You'd need a lot more staff and you'd need a lot more money. So it's pie in the sky for Labour to think that you could somehow pay a little bit more to doctors and that would sort 7-day working. It doesn't, it's not like that.
Okay, that's really interesting. We talked about it here on the show yesterday. The other thing we're talking about, and I don't know if you've seen the reporting of it, is this concern that NHS dentistry is teetering on the brink, and we've heard some extraordinary figures, for example, in the Southwest saying, 91% plus of NHS dentistry lists are closed. People simply cannot find an NHS dentist. But we had a caller, Sharon, who was a dentist from Salford, who said one of the challenges was because money was being diverted locally by the NHS Trust to other NHS services, there's a sort of false cap put on the number of patients that she could take on. Are you aware of this sort of push me, pull me fight between dentistry and other services in the NHS about who gets priority for funding?
Only in the sense of very recently, the integrated care systems have become responsible for commissioning dentistry, and they have a pot of money and they have to decide what their priorities are. But the problems with dentistry go back a long way, and they certainly go back to the dental contract from about 2006, which made it very difficult for dentists to do extra work and also introduced financial penalties if they did so. And this actually has pushed a lot of dentists into the private sector. So we now have a situation where the majority of dental treatment done in this country is done privately. And I think, unfortunately, the dentistry was a founding pillar of the NHS and made a huge difference to oral health. All that is now being lost. Unfortunately, in many ways, what's happened to dentistry is a kind of model for what's happening in the rest of the NHS, with financial constraints, lack of long-term planning, driving involvement of the private sector, and it's disastrous.
John, could the NHS ever have enough money? Is there any amount of money that the British taxpayer could put into the NHS to make it dentistry,
yes, I think it's
to make it all work? Could it ever have enough money? What sort of increase in funding does it need then?
Indeed. Well, if you look at comparable European countries like France and Germany, you would be looking at something like an extra 40 billion each year on the NHS budget to bring us up to their level. The NHS has been badly underfunded. Forget that we've given it more money than ever before. That's meaningless unless you look at demand, the changing population, the growing population. Then you actually find that the NHS has had a reduction in funding in terms of the demands being placed on it. But it isn't a black hole, and it's crucial to the economy that we have a good health service. We now have 2.5 million people who are out of the labour market because they're sick. And actually, you need to invest in the NHS to have a strong economy. It's not the other way around. You can't say, wait for economic growth and then we'll fund the NHS.
Okay.
It's actually fundamentally important to have a well-funded health service that gets people back to work.
Dr. Puntis, thank you so much for joining us here on Talk TV.